everybody, it's Melanie and I'm checking in with you with my 5-month post-op. It's actually 22 weeks, but it's 5 months if you go by the calendar. So let's get to it. I had the traditional duodenal switch surgery or duodenal switch surgery on March 30th, 2016. My doctor was Dr. Rob Williams of New Life Bariatrics, and my surgery was at Turkey Creek Tenova Medical Center in Knoxville, Tennessee. My highest weight was 335 pounds. Weight on the day of surgery was 314. Last week I did not weigh in with you, and I'll get to that in a minute, but the week before I checked in at 256, and this week I'm checking in at 256. So we're even, but I'm cool with that, and I will get into that with you. So the reason for the stall, if you've been following along in the ongoing saga, I've been fighting a urinary tract infection, and this has been the second week of it. And because of it, I've been taking some pretty heavy antibiotics. And that in and of itself, antibiotics, you're thinking big deal, right? And I kind of thought the same thing. Well, the first week, I was having problems, and there was blood in the urine and all that sort of thing, and it was hard to go. And my insurance actually has a program where you can go to it. It was after hours when I had the problem, when I noticed it. So my doctor's office was closed. I had the option to go to an urgent care clinic, and my insurance has a higher copay for that. And we also have, through my insurance, an opportunity to call a doctor after hours rather than having to go into the urgent care clinic, and that's called Teledoc, and we have a cheaper copay for that. So I called the Teledoc, and he asked me what was going on, and I told him, and he called in a prescription for an antibiotic into my pharmacy. This was 2 weeks ago, and I took it, and the infection didn't go away. It didn't knock it out. So the next week, this past Monday, I had an appointment with my regular doctor anyway for my well woman exam, and I happened to mention about the urinary tract infection problem I was having, and I was prescribed a different antibiotic. Well, I think here's where I ran into a problem and why the first antibiotic wasn't as effective. When I talked to the Teledoc doctor, I failed to mention about all the different vitamins that I was taking. I didn't put two and two together. I didn't think it was going to be an issue. Well, when I saw my doctor in person last week, I said, I take all these different vitamins. Do you think they're going to cause a problem with the antibiotic? My doctor said, I don't know. All I know is what medicines do. I don't really know everything about how they interact with everything. When you go to the pharmacy, ask the pharmacist, and they'll be able to tell you. So, when I went to the pharmacy, and there was a line of people behind me, and they could just kiss my big toe because I had questions. When you go to the pharmacy to pick up a prescription, normally they say, well, do you have any questions? And we usually say no, because we've been taking these meds forever and a day, right? Well, this time, because I was getting my antibiotic, my new antibiotic, plus my doctor has put me on thyroxine for thyroid problems, because yes, I now have thyroid issues. Didn't have them before, but I do now. And so the pharmacist there said, I see this is a new prescription. Let's go over when you need to take it. And I said, oh, by the way, with this antibiotic and the thyroxine and everything, I also take a whole slew of vitamins, and I happen to have my vitamin list with me. I keep it with me. And the pharmacist was like, wow, okay, yeah, these are going to interfere. So talk to your pharmacist whenever you get prescribed a medication, because you never know if it's going to interfere with something you're taking, and it includes your vitamins. Turns out that the antibiotic and the thyroxine were going to interfere with my eating schedule and my vitamins, especially calcium. Calcium, it seems like medications have more problem with calcium than I never understood it. You wouldn't think of calcium as something either hindering or reacting with meds, but apparently it does. There's a problem with thyroxine. So if any of you are taking Synthroid or thyroxine or any kind of thyroid medication, you better look and you better check. And if you're taking antibiotics, you need to check. So the doctor and I sat down, or the pharmacist and I actually sat down, and it was a lady. She was really, really nice, really patient with me. She says, let's figure up a schedule of when you can take this and take your vitamins and everything else. And she actually said, while you're on this antibiotic, do you think you might can stop your vitamins for a week? Just so you're not, because otherwise we're just not going to be able to make a schedule, because you're having to take things too close together, and it's going to interfere with this, with taking the antibiotic twice a day. And I was like, yeah, I guess I can stop the vitamins for a week. 1 week isn't going to kill me. So I've been off my vitamins for a week. I've just started them back yesterday. But the thyroxine, I said, can I take it at night? And she said, no, you really need to take it first thing in the morning, and you need to take it on an empty stomach, and it needs to be at least 3 hours away from your calcium, preferably 5. And I was like, whoa. Okay. So like my thyroxine, I have to set an alarm, and I have to get up at 5:30 in the morning to take the thyroxine. I keep the thyroxine by my bed, and I also keep a bottle of water. So the alarm goes off at 5:30. I take a sip of water. I take the thyroxine. I take another sip of water, swallow it, and I go back to sleep. And the pharmacist says, yeah, that's actually kind of common. So then later on, I get up in the morning and get myself ready, and then when I get to work at 8 o'clock is when I take my first meds and drink, and that's when I have my first protein shake too. So that, but I don't take calcium first thing in the morning, because that's when I take my iron, and you can't take iron with calcium. Yes, so even your vitamins themselves can counteract each other. So when you're taking stuff, even if you think it's, oh well, it's just vitamins, guys, there's no such thing as just vitamins. They're all important, and they can counteract each other. You can't take certain ones with certain ones. So like when I take my iron, I take it in the morning, and I take it with vitamin C. And then I don't take the calcium until later. And I don't have certain things with my calcium, and I don't have certain things with the zinc. And yeah, you really got to do your work on this. Just like with your medications. If any of you ladies out there have ever been on birth control pills, you're always told to you got to be careful with if you're taking birth control pills and antibiotics, because antibiotics can cause the birth control pills not to work. So there are some people that they take the pill and they get pregnant, and how in the world did that happen? Come to find out they were taking antibiotics, and that's when it happened. So ask questions. I don't know if you follow Experiencing Nirvana, but she has a fantastic channel, and Nirvana actually just did a video about advocating for yourself. And you really need to do your homework and ask your questions. If you've already had the surgery and you're having to ask all these questions, what's happening to me? Guys, it's too late. You should do the research up front. And suppose you did have the surgery and you didn't do your research. Start now. Find out. Whenever the doctor says, I want you to start taking this, ask him why. Why do you want me to take this? What's it going to fix? What are the side effects? What are the complications? How is it going to interact with whatever else I'm doing? How is it going to change my eating? Like with the antibiotic that I was taking, I couldn't have dairy. I couldn't have the calcium with it. So like in the morning, what I used to do in the morning, or what I'm back to doing now, my breakfast was a protein shake. Well, I couldn't do that on the antibiotic. So I was going using protein bars because I couldn't take it on an empty stomach. I had to take it with food. So I was having protein bars for breakfast. And protein bars and me just do not get along as far as the weight loss goes. I stall on those things. So that is why I have not lost anything. These past 2 weeks I have been stalled because my whole eating has been off. I haven't been able to have my supplements. I haven't been able to have the shakes. So it's been crazy. But now I'm off the antibiotics. I'm doing the Thyroxine. I take it at 5:30 in the morning. I'm back to having my protein shakes, and I'm drinking, guys. I'm up to 3.5 quarts a day. So if you're a duodenal switch or a Roux-en-Y patient, or you've had any kind of intestinal routing, it's important to stay on top of your calcium and your fluids. I preached it last week, and I'll keep on preaching it. So advocate for yourself. Ask those questions, because you can't expect the doctor to just tell you. We're finding that out. I wish they would, but they've also, I'm sure they don't even remember. And you're a pharmacist. Don't assume things. Ask questions. Let people know, hey, I am taking these vitamins. I am taking these medications, and I have had these things done to me. How is it all going to fit together? Are there going to be any problems? Am I going to have to rearrange anything? Because if you don't ask and if you don't advocate for yourself, you can run into some big problems. So that's it. And please, whoever is protein shake manufacturer, don't make pumpkin spice. I am sick of pumpkin spice, and it's not even officially fall yet. I went to the grocery store the other day, and guys, they had pumpkin spice Cheerios. I have seen pumpkin spice everything. Pumpkin spice nuts, pumpkin spice popcorn, of course pumpkin spice candles and air fresheners and muffins and pastries and you name it. I mean, I'm looking for pumpkin spice toilet paper before it's all over with. I'm sick of pumpkin spice. Move on. It's go somewhere else with it. I don't want to see any pumpkin spice protein shakes, and if they do, I'm gonna boycott them. Anyway, love all of you. Have a fantastic week, and I will see you again next week, and hopefully we'll see some more downward progress on the scale. Okay, love all of you, and sparkle on.